We need to have compassion and empathy, don't we, and have an understanding what health inequalities affect people within our neighbourhoods.
Yes. I think, the difference is every neighbourhood is different as well, so what would be unequal in one would be more equal in another. Different people's understanding of what they can access as well and how they find out that information. I think it would be about understanding how legislation impacts, so that, legislation is being followed. But legislation on its own isn't enough, as you said before. It's about that compassion, about that understanding, and that willingness of wanting to make things open and accessible to people.
I suppose it is about having it in your mind, isn't it? I think that's why this training is going to be really helpful, because it's so making sure that we have inclusivity, and it underpins everything that we do.
So we're really lucky to live in a vibrant and very broadly mixed city. We welcome people from all over the world and all over the country, both to study and work. And we have a long history of encouraging people to stay with us in our city, and that therefore means that we reflect society in its broadest sense. There's many things to celebrate about that, but it also brings its challenges, particularly around some very deeply entrenched deprivation, which we see across all of our populations, and it can be factored up for some people in some circumstances due to intersectionality and layering of deprivation for them. So we couldn't possibly consider commissioning healthcare in our city without understanding our communities and what their needs would be.
Just really to start, that this is the opportunity for us to deliver this work, this part of our inclusion strategy now is absolutely imperative. You're the new neighbourhood leads, some of them, and the new neighbourhoods present a new landscape for us, and that enables us to change the culture in a way that you can't do at other times.
As part of MHCC's commitment to improving the processes and practices for both inclusive employment and service delivery, we are revising the weighty and cumbersome equality impact assessment process in favour of a much lighter weight, easy to access set of tools and processes. The aim for this refresh is firstly to support the creation of the right conditions for recruitment, to draw from a more diverse talent pool and provide equitable working conditions and opportunities for all staff to develop their talent. Secondly, it's to ensure, through commissioning of health and care services through to delivery, that due regard is given to equality, diversity, human rights and socio-economic disadvantage, and subsequent actions taken to address any disadvantage or discrimination. Result CIC, a Salford-based community interest company, specialise in working with marginalised people and communities, and they led a day-long series of discussions, workshops and individual coaching sessions to a group of mentors, providing wraparound developmental skills, readying them to support other leaders in our drive towards inclusive practices, in particular with regards to the recruitment of senior leadership roles. This group will play the role of champions in inclusive recruitment and in the embedding of the new EIA process. The key outcome for this project is to ensure that mentors embed the revised equality impact assessment process in their working practice. They will do this through an increased understanding of their role in contributing to the new process, a better understanding of how to embed positive action legally and appropriately in the recruitment process, and an improved understanding of ways to challenge unacceptable behaviours in the workplace via increased confidence and skills.
Inclusion is absolutely key to our organisation. We live in a city that is multicultural, it's diverse, and we as an organisation should reflect the city that we live in. The more people you have in the organisation that are from different backgrounds, different sexualities, people with disabilities, women, etc., you get better inclusion and better decision making in organisations such as ours, because you get people around the table with different thoughts, different ideas, and you get a much richer conversation, and I think that helps to make much better informed decisions, particularly in regards to the people that we serve in Manchester.
Yeah, today it's been really interesting and challenging, and it's made me think about the whole, what is health equality and health inequality, and it's definitely thinking about who is not accessing the services that they should be accessing, and what are the barriers to them accessing them. It's made me think that when you are developing services and even new ideas, really to get that whole inclusion, the whole idea of inclusion is really that the baseline, not to sort of have it as an add-on or a tack-on, but actually you just need to really be thinking from the very beginning, how will this impact various people, and ideally involving those people themselves to say how it will impact them in an ideal world. But even if that isn't the case, that you've actually thought it through and given some thought to it. I think having a tool such as the Equality Impact Assessment, the one that Jackie outlined to us, I think will definitely be a framework within which to do that. So it's like making sure that you haven't missed any questions out, that that you're really thinking it through. And be given that the communities that I work in are very, are diverse, and there are quite a few people who probably don't really, feel that they can access everything that's there, or maybe don't feel it's for them. And I think just having other colleagues to chat to and to sort of, understand their points of view, and the whole thing about like recruitment and how the services that we have in our community need to reflect who lives in our community.
I think having a template with the protected characteristics would be really useful for people going through a process when developing projects or plans. I also think the inclusion of socio-economic status and social value would be really useful, because they generally haven't been involved or included in those kind of impact assessments before. So they'll shine light on those areas and make people ensure what they're doing is reflective and addresses these issues. This whole training has been really useful to get me to revisit something I hadn't done in a long time, but also to remind me of some of the gaps I've not been thinking about. So when planning projects and things, we generally think in one dimension, and even if we think of it slightly broader, we don't think in terms of everything and all those characteristics. So this for me has been invaluable and will shape what I do in the future, because I'm now acutely aware of what I should be doing.
So the difference today has made for me is really put equality front and central in the role of the neighbourhood lead and the neighbourhoods, and I think particularly reminding us, whilst we are focusing on neighbourhoods, we do have that responsibility to the health of our population across Manchester, and particularly useful for me has been a focus on the assessment tool that we'll be able to use, and being able to share experiences within the team. It's brought us, I think, a clarity as a team in how we're going to take things forward. In fact, we've got part of our actions to come together and put it central to our action plan as a team of neighbourhood leads, and I'm really, really pleased with that. I felt it was really vibrant. I've really, really enjoyed the day. I've got a lot out of it, and just want to say thank you.
I think what this day has done for me, and not just for me but for the people I work with, so my team are the neighbourhood leads, so they are people that we have recruited to facilitate and help deliver a different type of health and social care work and workforce in the communities. It's helped them and I understand how you shift inclusion from a specialist expert thing that a few people do in a darkened room to something that's everybody's business and is part of our core business. And I think both them and I could understand what the individual contribution we can make is, but how collectively we could come up with a course of action. And that is really good because I feel less lonely. So on the back of today's event, what we've agreed is that we are going to pull together a group of interested parties to really think about what an equality analysis of our neighbourhood model might look like and where we might start and how we might break it up into chunks and think a bit about what data we've got, what groups we've got that we might want to. So we've got a practical plan and that's worth its weight in gold.
Today has really given us the opportunity to say, right, well, how do we embed that within our day-to-day work? Certainly the equality analysis approach and the equality impact assessment tool give us a real means and vehicle to drive some of that work. And we've already agreed to definitely go away and start using it in some very, very specific circumstances, which actually will move some of the work that we want to do on. But not only that, I think one of the real recognitions of today is around, and we know this already, of health. 10% of health is how good your health service is, 90% is everything else in the world. And as such, really realising the social value in our communities, really getting an understanding of actually how can we reach further, how can we do things better, how can we be more inclusive of a whole group of organisations and people out there who make a real difference on a day-to-day basis, I think is something that I personally have really taken on board.
I think if you're an organisation that's inclusive and diverse, you get people coming to work where they can be their authentic selves. And I think that's really key because people bring their whole selves to work. And I think if cultures are inclusive, you get people staying longer, people want to work for organisations like ours. It helps with our retention, it helps with our recruitment, and we're also working on making sure that we enable people to progress within our organisation. That's a really key and important piece of work for us as we go forward with our inclusion agenda.